Hello, everyone, and welcome to this week's webinar. We're super excited you're here. We also have a live demonstration today. So if you are here for the Measure Long-Term Impact with Secure, Robust Case Management Software, you're in the right place. Like I said, we're glad you're here. My name is Kristen Shoemaker, and I am part of the commercial execution team here at Bonterra. I'm stepping in for our Senior Virtual Events Manager, Amanda DeFontes, today, but I will be your moderator and host. I am joined by Colin and Justin. And like I mentioned, I'm joining live from Dallas, Texas. If you guys would like to, drop in the chat and tell us where you're joining from. We like to see where everyone's coming from. We know it's either after lunch, during lunch, or before for you. So like I said, we're glad you're here. Before we get started, I just want to go through a few quick housekeeping notes. So the chat is open and available, so please feel free to use it throughout the presentation to connect with us. If you have any questions, we recommend that you put them in the Q&A box. We will answer them, as many of them as we can during the live presentation. And if we don't get to all of them, we will answer them at the end. The webinar today is being recorded, so we will send out follow-up emails early next week with the recording. And then, like I said, if you have questions we don't get to, someone on our team will reach out to answer those. So, like I said, welcome again to our Measure Long-Term Impact with Secure, Robust Case Management Software, the live demonstration. So let me go to my next slide here. So for those of you who aren't familiar, Bonterra makes software for the greatest social good, propelling you and your mission to peak impact. So you can raise more, match more, grant more, help more, and do more good. We have brought together the powers of social solutions, Every Action Network for Good, Cyber Grants, WeSpire, Salsa, and many more to achieve your greatest good. We are on a mission to help you deliver life-changing programs for a greater impact. If you're curious about Bonterra tools and how they might help you and your team save, please go ahead and fill out this poll, and then we will have one of our team members reach out to you as well. The poll will come in just 1 second. All right, there we go. So as you fill that out, I'm going to go ahead and introduce Colin Boucher, who is one of our solution architects here at Bonterra. He just celebrated his 6 years with Bonterra, which is a great achievement, and you are in good hands today. So Colin has a wide variety of experience and is joining us from Canada, and he will be our subject matter expert in today's demonstration. So Colin, I'm going to stop sharing my screen and let you take it away.
Perfect. Thank you, Kristen. I'm also jealous of our guests' locations in California and Florida. It's snowing where I am in Canada, so I wish I was there. I'm going to share my screen. There we go. Can you see that okay? Is that working, Kristen?
It is. We can see it.
Perfect. All right. Hi, everyone. So yeah, my name is Colin Boucher. I'm a solutions architect. 6 years at Bonterra, 5.5 years in frontline HIV case management, community development kind of work that I did at a local not-for-profit. So I am passionate about public health. I'm passionate about impact, changing communities, improving people's lives. That's what I'm here to talk about today and how our solutions can help you do that. Couple sort of ground rules, housekeeping kind of points at the start, talking about what our goals are and are not for today. So point one, while impact management, as we call it, can be used for all kinds of different public sector use cases, we are going to be focusing pretty heavily on public health specific themes today. But we would love to talk with you after the webinar to discuss potential specific use cases for your organization. Point number two, I hope that you come away from today with a better understanding of how Apricot's features can be utilized to measure the impact that you're having on the communities that you serve. Number three, I hope today, if nothing else, gives you enough information to check off the boxes of the features that you might be looking for so that you can confidently conclude whether or not we're worth a deeper dive after today or not. Hopefully we are. And point number four, my presentation hopes to answer a lot of those really basic 101 style questions about our platform that you might have, coming into today. It's not going to be a, you know, complete deep dive into every feature. Unfortunately, we don't have time for all of that. But in those one-on-one follow-up conversations that you'll be having with my colleagues in sales after today, you will hopefully already have a lot of those basic questions answered so that you can really kind of dive into those 201, 301 style questions. And we can get you the answers that you need. And then importantly, our goals for today are not entirely replacing your tech stack with Bonterra's impact management platform. Many public health or public sector organizations, have programming that is very specific, uses very specific software. We're not looking to replace everything, but hopefully we can help improve the impact measurement of the programs that you have or are looking to explore. It's also not having all of your questions answered about your particular use case. As I mentioned, those are more for those one-on-one style follow-ups that'll follow after today. That being said, I'm going to try to leave time at the end of today to answer questions as we go, but I may say, that's more of a specific use case 101 kind of question. All right, so let's begin by talking a little bit more about Bonterra as a whole before I get into the product specifically. So you may have heard the name Bonterra from social media, from our website, email signatures, or you might be familiar with some of our products under those different legacy brand names that Kristen was mentioning earlier. But I'm going to tell you a little bit more about who we are as a company. So Bonterra is a public benefit corporation on a mission to help public sector, social good organizations, or SGOs, as we sometimes call them, nonprofit organizations, and corporate philanthropists make long-lasting change in communities and to improve outcomes. And with the goal of sort of growing the amount of financial resources available in the social good space. As you can see from some of our key stats, we touch many lives through our family of products, whether it be through our fundraising and engagement platforms, our corporate social responsibility, to our frontline impact management solutions. So why these areas specifically? Our vision at Bonterra is to create a virtuous cycle of trust between funders, supporters, practitioners to grow that size of the giving pie. We offer a variety of solutions with these three focus areas of being strategic philanthropy, sometimes called corporate giving or corporate social responsibility, fundraising and engagement, and then our focus today, of course, which is on impact management, more specifically, talking about program, case management, that kind of stuff. And that's what I'm going to be showing you today, specifically a product called Apricot 360. So let's talk more about that and what software solutions are out there today in that specific space. There is a spectrum of technology that many orgs use to track their client data, right? But they're not all made equal, and there's pros and cons to each. So I've made this infographic on how I like to think about the key differences. And this is kind of comes from, years of working with different, public sector orgs and the different tools that they have and their challenges and, issues with them. So on the far right-hand side, you have your EHR, or you might call it like practice management solution, that kind of thing. Many public health units across the country tell us that their existing EHR tools are great at tracking things like mass immunizations, contact tracing, sort of lab stuff. But where it falls apart is when you want to track the impact, where you might want to follow a single client through a journey, doing several assessments, goal setting, service plans, case notes, basically trying to show that their lives are improving or not based on the interventions that you're doing over time. Because EHRs tend to be singularly focused on things like billing, service codes, that kind of thing, they tend to lack the flexibility to be able to make on the fly changes to the configuration, adding new questions or assessments when needed, hard to spin up an ad hoc report when requested. So it's a very hard coded, rigid kind of system. great for specific things, but like all the time, people are coming to me from public sector saying like, we need something else. We need something that kind of meets that more mushy kind of flexible pathway. On the other side of the spectrum is a generic CRM salesy kind of tool like Salesforce, which is incredibly configurable, of course, but it requires a lot of technical skill and resources to build out for your specific use cases. They can often require hiring an expensive administrator that you have to pay whatever you want to make, like a change order or tweaks to your system. And additionally, their implementation partners often don't have the background knowledge in social services or public health. So you have to spend a lot of time kind of educating them on the subject matter itself. Where we win is in the middle, in that Goldilocks kind of zone, where we have a focus on working exclusively with not-for-profits, public sector organizations looking to improve people's lives. That's what we do all day, every day. That's our single focus. We recognize that our users should be empowered to make the use of our best practices, reports, and tools, but also have the control to develop their own forms, their own assessments, their own reports, spin up things as needed without having to constantly come back to us to make changes. And that's kind of where we sit in the middle. So let's talk about Apricot. Apricot 360 is a no-code solution designed to save you weeks of time in configuration and administration. It's highly scalable. We have orgs with as little as 10 users and one program, or several hundred users and dozens of programs. New programs, new users, new security roles can easily be added over time because it's designed to scale. Most of our organizations, will start with a certain set of programs and configuration and then grow over time, adding new users, adding new forms. That's a very typical pathway for our customers. Apricot has the best in class security. So we're on AWS cloud, we're HIPAA certified, SOC 2 type 2, and we have single sign-on and other authentication options that you can use as well. Okay, just two more slides and then I'll close this out. So a few years ago, we completed a return on investment study with a third-party company called Hobson & Co. And they found that Apricot had a profound impact on the agencies that purchased it. So note, these are the minimum expectations that you should have when moving from any other EHR cloud-based system to Apricot. But if you're moving from Excel, that sort of rudimentary column on my previous slide, you should see an even more significant return. And then lastly, here's just sort of a quick snapshot of some logos of public sector orgs that we've already been working with over the past several years who use our impact management solutions. We're very comfortable working in that space. All right, so without further ado, let's get our eyes on the solution. Let me stop my share, switch this over. Right. Kristen, can you see my Apricot screen?
Yeah. Yes, we can.
Perfect. Okay, so here we are. This is Apricot 360. Apricot 360 is Bonterra's enterprise level impact management solution that is highly flexible, highly configurable to meet all of your case and program management needs. As I mentioned in my slides, it's AWS cloud-based. So anywhere that your staff have internet and a browser like Chrome or Firefox, they can access Apricot using their secure login. As I also mentioned, we are HIPAA compliant, SOC 2 Type 2 compliant, and we meet current HUD domestic violence, HMIS, and Social Security Administration protocols. In terms of the security settings inside of Apricot, your Apricot administrator, so whomever of you, would become the admins of the system, will have the control to see who sees what in the system, including on these home screen bulletins, which are these entirely customizable sort of colored blocks that you see here. Notice that I added at the top our Bonterra logo, but you can, of course, customize this. When I do one-on-one demonstrations, I always change it to the customer's logo just to kind of help you see yourself in the system that way. You can also time these bulletins so that they expire or appear at certain times. So in this example, I have like a quarterly report due reminder that I could have pop up at, a certain time period and then disappear at the end of that time. Admins will also be able, if you're an administrator, this is a really cool feature I love. You can see through the eyes of different users in the system, kind of experiencing the view from their perspective. Um, Really, it's designed to help you test the security boundaries that you set up, but we're going to use that feature today to pretend to be different characters. So I can kind of show you things through the eyes of different levels of workers. And we're going to use two characters, Penny, the program manager, and Chase, the case manager. So we're going to start with Penny. So I'm going to transform into her. And you can see as I do this, the bulletins change. Some of them stay the same, some of them are different. And remember, today I'm going to be showing you some different form and report examples based on real use cases that I've heard directly from our customers in the public sector space to try to help you see yourselves in Apricot. But keep in mind that this is just my demonstration database and yours will look different depending on your specific and unique needs. So if you take nothing else away from today, remember that Apricot is highly flexible, highly configurable based on your needs. So with that in mind, Penny is somebody who is in charge of looking at high-level data across multiple sites, multiple programs. So she's going to see dashboards that I built that I thought might be interesting to somebody at Penny's level. I know there are some aging sector folks on the call who registered today, so I made kind of a sub, sector aging specific example to show. So this one is showing the activities of daily living and instrumental activities of daily living. If you're not familiar with what that means, it's a measurement of how independent a senior might be, which can help determine the level of care they may need, right? So these scores are averaged out by site at their intake of the clients. So why would Penny want to see this? It'll allow her to kind of get a high level view of the level of independence that clients are coming to various sites with, which could then in turn help her plan for what resources are most needed at what sites based on the needs of those clients. Second example I'm going to show, we're going to come back to that one for more detail in a second, but this one is a breakdown of clients by program, be they, in this first example, active clients or clients enrolled in the last 30 days, or the reasons that clients left within a predefined period of time. So these kinds of operational sort of reports can help keep Penny up to date on what the organization's capacity is looking like so that she can kind of plan, who's needed where accordingly. And then last is the change over time breakdown of our HIV case management clients' respective viral loads. And I'm going to come back to this one in a minute because I really want to focus on that impact piece. But first, we're going to drill down into that ADL, IADL, and I'll show you what that looks like. So let's say Penny wants to drill down into any of this data of any of these reports. She can choose to open the appropriate section on her dashboard and to click into any of the corresponding, like any of the cells to jump to the corresponding record that holds that data. So we choose a client under USC Family Caregiver. Let's go with Maria Peterson. If I click on her score here, it's going to take me right to the record of that assessment that took place. So in Apricot, administrators will have the power to build forms and reports just like these using our easy drag and drop functionality. Now, this is one of the ones that's actually in our template library. I mentioned it really briefly on my slide deck, where you can use ones like these. You can take them off the shelf and implement them immediately, or you can build your own from scratch, or you can take one off the shelf and then tweak it. Like a lot of our customers might have a culturally specific lens that they want to do an assessment through. So they'll take one of our examples and then tweak it to kind of meet their needs. So you can do that as well. That's what it looks like on the front end, but also let's take a look at what it looks like on the back end. So this is what it would look like to an administrator or somebody who's building out an assessment or a form like this. So in this example, I created a scoring scale where her answers result in a number that are then added to a calculation field at the bottom. So for example, if I say, do you need help moving from a bed to a chair and back? I hit the little gear icon here. Here's the responses, and then here's the weighting of the scores for each of those responses. As I go down here to the scoring, you can see that it adds up all the scores from each of those responses and then gives a total. The ADL, IADL is actually two separate scores. So there's one here and then one down here. You could have, they don't sum together because this example doesn't do that, but if you wanted to, you could. The other thing I'll call out here, if I hit that gear icon again, you get to decide things like, is this a required field? Is this a searchable field? Is this a duplicate check field? Is this a restricted field so only some users can see it? And I'll talk more about that in a minute. So full sort of control. And this is not just a tool that I have as a Bonterra employee, but anybody who is administrator of Apricot will have these tools. We don't hide any of the tools from you. Let's say, to use a silly example, you want to create a new question. So 6 months down the line, your funder says, hey, starting today, all ADL, IADLs, we need to also ask what their favorite color is. No problem. You can come into here. This is the building tool. It's all drag and drop. So if I drag and drop down field over here, I can throw that in, change the title, favorite color. We want to make this a required field because it's super important to know. Put in my values, etc. Save it, apply it, and then all I would do is hit publish, and then it would be live, and then you have that form. So no change orders, no needing to come through us. You can make these changes totally on your own. All right. So the next
Colin, we had a question come in.
Yeah, go ahead.
The question is, we are a government program that has an application portal and holds case management along with technology issuances all wrapped up in the same database. Does this solution allow for public users?
Can you define a little bit more what you mean by public users, like as in staff in the system, or?
That is a good question. We do not have that context. And if you ask that question, maybe you can provide a little bit more. Those who are not employees, perhaps.
Yeah, so you get to control. There's a couple options there. So one is you can create what are called guest users in the system. That's a different tier of user where they have limited access to up to 5 forms in the system, and that's it. So that's a licensing model you can do. Another way of doing that is you can create basically very restricted secured access where the user only sees their specific clients or their specific program and the details under that, or only clients that are assigned to their specific site. So that's different security settings you can put in place there. I'm not sure if that answered the question though.
No, that's great. Thank you so much.
Okay. All right. So the second dashboard example that I thought Penny may want to take a look at is that collective impact that our HIV case management work that we're doing is having on the viral loads of our clients. So this is the kind of thing we mean when we say impact management. So something that is staged and scored. Staged meaning, there's an initial assessment, a midpoint or progress, 30, 60, 90 days, and an exit score. And scored meaning that there's some kind of a numeric value attached to that. And that's going to allow us to demonstrate how our efforts have resulted in positive changes in our clients' lives. So here below, we can see the change over time one by one. So an example of Ann Walker, you can see she started at a 13, she went down to an 8, and then she went down to a 3. But collectively on top, we can see the sort of aggregate change over time from all of our clients collectively. This is a really good way to demonstrate that impact. That's why we call ourselves impact management, right? So you can say, due to our intensive HIV case management work, the collective level of viral load for our clients is decreasing over time, meaning the program is working. Or maybe it's not working and the program needs tweaking or changing to do that. Kristen, I believe you had a second poll you wanted to to throw out there about change over time.
Yeah, let me go ahead and launch the second one. So it's, do you need tools to help measure greater long-term impact?
Perfect.
And I'll leave it up here for about a minute, but Colin, you can continue moving on here as well.
Perfect. All right. So the next bulletin report I created is showing both the approved and pending statuses of various case notes. So the pending drawer contains notes completed by caseworkers that require sign off from someone else. This is another common, as I say, all these examples are real life use cases that I've heard from public sector. This is a common one where, something more clinical, you need to have like a sign off from a second party before it gets approved. You can add rules and alerts around these kinds of things, like when a form gets completed, like an incident report, or when approvals are needed on signature fields, like in this case. These alerts can be configured to be both inside of Apricot and or in email form, whichever you prefer. So once again, let's stick with our Maria Peterson example and take a look at her clinical case note. And when I say example, like this is an example of a clinical case note, I'm intentionally going to show you two very different styles of case notes to emphasize how customizable this can be. But this is an example which is very clinical heavy. It's got a lot of questions, a lot of content. And then the expectation here is that someone like Penny would be going down, reading through, okay, what goals were talked about, what's the treatment plan, what's the assessment, and then the clinician signs off on the bottom. And then at the bottom, the very bottom, is the management only section. Remember earlier when I talked about restricted fields in Apricot when you're doing that configuration? This is an example where these would be hidden. If I hit hide here, from a caseworker perspective, they would see this, but Penny can see this information here and she can decide, yep, this is approved. Yes, I want to sign off on it. It's approved. And then when she saves that, it would drop up into the approved bucket on here. So, the reporting is in real time. There's no lag between when a change is made on the actual form to when the report updates with that information. So now that you've had a little taste of what things can look like from the management level, let's change our view to Chase the case manager, so changing hats, and see what things look like from his perspective. And you'll notice that when I did that, the bulletins changed. First one, still the same, but then these are some new ones. So he has a bulletin that has customized shortcuts that can kick off various processes to make Apricot super easy to navigate and reduce the number of clicks to get to different areas in the system. He's got another bulletin that tells him when was the last time that he or his team met with each client on his caseload. This is a request that I've heard many times, again, from clients. This will enable, Chase to be able to make sure that he's staying on top of his clients and that nobody's falling between the cracks. So if we look at Chloe for an example, I last met with Chloe 8 days ago. We did case management for 60 minutes. I gave her clothing and we talked about our goals. And this is not like a cookie cutter standard like report. This is bespoke, custom made, where I chose each of these columns because those columns are important to me and the use case that I have. In a bit, I'm going to show you what it looks like to build these reports, and so that you can choose the fields that are important for you when you're reflecting them on these kinds of dashboards. But again, if I click into this, it's going to take me right to that case note. And remember how I said I'd show you two different examples. this looks very different from the clinical case note example. It's got less questions, it's got more narrative style questions, it's got some linkages to the program enrollment and the goals. Again, just wanted to emphasize that customizability piece. So totally different from the other one. The other thing I'll note here is the ability to link in these goals. So anytime you see one of these add or new green buttons, it means that I am summoning a form that exists somewhere else in Apricot, and I'm linking it to this form. Why? Why is that important? Let's say you wanted to report on the categories of goals. So because this is lumped into a housing category, maybe Penny, to use our other character, wants to know how many times were housing goals created in the month of January. She could run that report. But with the linking, she could also report on how many times were housing goals discussed in the month of January. And it would be looking at the case notes that are linked to housing themed goals. So that's how that linking is sort of the secret sauce, as I like to say, about Apricot and how it can be so customizable and configurable. Essentially, you create your own objects and can connect them to each other in that kind of way. All right, next thing, or last one I wanted to show you about from Chase's perspective. It's really just another way that I can display this kind of data around the activities I'm doing with my clients. So this one tells him if he's meeting the service standard that I've set in my hypothetical public health database, where he's expected to have at least 2 meetings with every client he's assigned to within any rolling 90-day period. Of course, this is all customizable depending on your needs. So 2 days was just 2 appointments, was just the one that I invented here. All right, so I'm going to switch back to myself, Colin the administrator, so that I can see everything. And now let's say I want to search for that same client, Maria. If I go up to search records for participant, I already kind of have her pulled up here, but as you can see, I can choose which elements I want to be able to search by. And I can even combine it with elements from other forms. So let's say, I want to look for clients whose primary language is English and who are assigned to this program and are in the phase of, phase 1 or something like that. You could do that with the search capabilities. So let's go ahead and take a deeper dive into Maria's folder. So here is where I can see everything that Maria Peterson has ever done or ever could do. This list is called the doc folder. It's going to look different, again, depending on the role that I have in the organization. Because I am Colin, I'm seeing like every possible form in my system that I've implemented. But if I was Chase, I might only see a short list of the forms that are available to me. So I don't know if this gets to that question that was asked earlier, but let's say, for example, you have a user that needs to be able to do case notes, needs to be able to see her program enrollment, but has no right to read her ADL, IADL. So that, specific assessment on her capabilities, her mobility, or, has no right to see her mental health assessments that haven't done this example here, my short mood and feelings. So you can hide those forms depending on the role that the person has in the organization. The idea here too, where the customizability comes in, like you can choose the order that these forms display in. You can also choose, see all these headers here, like program enrolling, funding source, exit date, date of service, time. These are not set for you. They are fields that I have chosen to highlight as what are called quick view fields. So on the build side, if you may have seen that little tick box for quick view, this is what it means. It means that I can peek at the data that's contained inside the form without having to actually open the form and read the information within. So like, let's say I just wanted to see a quick look at Maria. When was she last met with? How many minutes was she met with for? And what did we do? I don't have to actually like flip through each case note to see it. I can see it all in this one spot.
Colin, we have a question that came in from Rick. So in the example that you just showed, it referenced the document folder. Our
Mhm.
agency already has existing document storage solution. Can Bonterra Apricot link to this information?
Yeah, so by document storage, are you talking about like attachments, like sort of PDFs, image files, things like that? Or is it more like the data contained within them? Because it,
Um, they use a separate system for it. Laserfinch?
gotcha. So if it's like a separate data system and you want to be able to like import or reference the data from another system, we have integration solutions for that. So we have, everything from the cheapest option, which is like a manual export import that you can do if you're needing to move data from one system to another, to SFTP, all the way up to API, like full API integration with something like Zapier or a custom build API that can in real time move the data from one source of to another. If you're talking more about attachments or like sort of static like objects like PDFs and that kind of thing, we also have that ability as well. So here's an example here where, let's say, I need a scanned copy of Maria's driver's license that I can put into here. Any field or any form that you create, you can create attachment fields where you can come in here and drop that in here, and it will store it. So Apricot also can be used as a place to keep those sort of static documents that don't have reportable data on them, but you just need a place to put them. I hope that answered the question.
I think so. And if we didn't, we can definitely circle back on it separately too. And then we did get some additional information on Christina's question about allowing for public users.
Mhm.
And so they have caregivers that apply for their program online and fill out the application.
Caregivers that apply for their program online and fill an application. Oh, I think I know what you're talking about. Okay. So, yes, that was actually one of the, how are we doing on time? I'll talk about it really briefly, and then I want to talk about reports, and then we'll kind of open it up to questions. But it was actually one of the features I wanted to show if we had some spare time. But since you asked about it, I'll jump to it now. So those forms that I was showing you, those assessments like that, the profile information, you can format it in a way that it is public facing using something called our intake form web forms. So this is an example of one that I have. So you would create this sort of a do-it-yourself tool inside of Apricot. You'd build these based on your forms in Apricot, but it transforms it into a public facing link. So you can embed this on your website. You can give this to your care partners that are referring clients your way. That way, they don't need a license in Apricot to use it at all. They would just fill in the information about the client they're sending your way, or the client themselves can fill it in, raising a hand saying, hey, I need help. Um, all of this information would be securely transferred into Apricot into one of those bulletin reports on your dashboard, for example. They're also mobile responsive. So I have this little plugin that can show you what it looks like on a phone. So this is a kind of a two forms smushed into one. It's your basic demographic questions, and then it's kind of a needs assessment of your social determinants of health. But again, totally customizable. Whatever fields that you have in your forms, you can make it public facing in an intake form kind of way. Did that get to the answer?
I think so.
All
And
right,
we have about 20 minutes left. So if you want to jump into your reporting, I think we're still okay on time.
perfect. Glad you asked that because yeah, I was excited to show that. It's one of my favorite features. All right, so let's talk about how easy it can be to actually build these things, the reports that I've been showing you in my bulletins. So it's kind of like a cooking show in reverse, right? Where I show you the finished product, and now I'll show you what it looks like to actually put this stuff together and how easy it can be. So as again, administrator only privileges, You can delegate report building powers to standard users in the system, but by default, it's something that only admins can do because, of course, it gives you access to all the data, and you don't want to give that to everybody necessarily. So I'm going to say public health demo. I'm building one entirely from scratch. And for the sake of time, I'm going to make it real simple. So blank slate, this is what it looks like to start from scratch. Over here on the right are all of my data sources from all of my forms. So every single field, every single form in that doc folder that you saw, it's over here on the right. It's drag and drop, no code environment. As Kristen mentioned off the top, I come from the nonprofit sector. I am not a technical person by nature, but I learned how to do this very easily. And this black text represents that sort of master profile about the client. And then the green text underneath are like the forms that live underneath of that. So let's say I wanted to do a demographic form that pulls in some demographics about my clients. Do first name, last name, gender, date of birth. And let's say my hypothetical question I want to answer is, what is the racial breakdown of all of my clients that are enrolled in a certain program, who enrolled after a certain date, and who have not left the program yet? So that's a few different conditions I'll put in here so you can see what that looks like. So first I've added my demographics. Now I'm going to add my program enrollment data. So let's pull in start date. Let's pull in program enrolling. And let's pull in exit date. Okay, so now to use the cooking analogy, now that I've kind of put all my ingredients on the table, I can start to play with it and kind of cook. So first thing I'm going to add is I'm going to say, we only care to see clients who are enrolled in X program. So in my case, I'm going to say program enrolling matches, and I have a ridiculous amount here because my demo database, but I'm going to say long-term case management. So you can see that instantly cuts it down to 49 rows. This isn't the finished product, by the way. It's kind of just like a taste, like a preview. So you'll notice you might be like, Colin, it's not showing me 49 rows. It's only showing me like 10. That's why. You'll see it on the final version. It's just kind of a check as you're going along to make sure you're doing things right. Next filter I'm going to add, let's say I only care to see clients who have started within the last year within my program. And you can see all the different filtering options I can choose from, is after, is before, is within, is between. I'm going to say within the last 365 days. So you can see that cuts it down again to 31 rows. Now I have one more filter I want to add, which is I only care to see existing clients. So if they've left, they'll have an exit date, and I want that exit date to be empty. So that's going to cut it down to 30 rows. And I could, and now I think I said race was the one we're going to break it down by. So if I hit the little gear icon here and say group by, it's going to split it up into these different categories. You can see that I'm missing, it's not a required field, so I'm missing that data on 3 of my clients. If it was required, of course, I would have the data. And then for all of the others, it gives me some examples here. And I could be done here. I could hit publish and then I would be done and I would have this data. But let's say I want to take one additional step and I want to make a graph out of it. So if I hit show graph, instantly it's going to create a graph of that data. There's different styles you can choose from. My personal favorite is the 3D donut. It's my favorite one, but there's different kinds you can make. If you want to get real fancy, there are different themes you can choose from, and you can even like get the specific like RGB color code if you want to make it branding specific. If you really want to impress, your executive director or board or something like that, you can do it that way as well. All right, so once I'm done, I'm going to hit publish and run. So this is the actual run side of what it looks like. This is the results. And just like the other examples on my dashboard, all of this is clickable. So if I click into, who is Samantha Day anyway? If I click on her name, it'll pull me to her profile where I can see her specific, information about her. If I wanted to export this data, if I hit the export button, it is instantly thrown into a CSV where I can do more with that data. Of course, the aim of Apricot is to get you away from relying on spreadsheets, but we also recognize that sometimes, like, if you're talking about a data exchange or something like that, if you want to get data out to put it into another system, any report you build, you can export into this sort of format. I know you've seen a spreadsheet before, so I won't spend too much time on that. The graphs themselves are also exportable as images or vector files as well. And then, as I mentioned briefly on that HIV theme, if you don't want the users to necessarily see all the details of like who's who, you don't have to include their name. You could include just their record ID, which is sort of anonymized data, or you could hide all these tables and only have the graph itself appear so that there's no like identifiable information in that too. And then the last step you would do is just if you wanted to turn it into one of these dashboard kind of reports, you could do that. Although not every report is a dashboard and not every dashboard is a report, right? So the buttons, for example, aren't a report, but it's a bulletin. The bulletins can be reports that need to be looked at every time you log in. So something operational like this one. But really, if it's the kind of report you only need to look at once a week, once a month, once a quarter, you can tuck it over here under My Reports and then just run it, anytime that you need to create it. All right. Kristen, do I have time for one more feature before I turn it over to Q&A? Or do you want me to stop?
I think you have time.
Okay, cool. One more thing. This is really just for me. I used to be an outreach worker, and that involved doing, mass education sessions with an audience, doing, distributions of safer sex supplies and public health, that kind of thing. And I tried to imagine what it would be like to be able to track that kind of stuff in Apricot. So part of today, I wanted to emphasize that not everything you do has to be tied to an individual. Because Apricot is so flexible, you can create forms like these that have nothing to do with named clients. So in this example, if I was doing street outreach or a distribution event, let's say that I was the one that did it, I have this sort of conditional logic here where if I'm putting in the specifics of the supplies that I'm distributing, you can see my conditional logic is going to reveal the different categories as I'm going through. I can go in and put in the number of supplies that I'm distributing, save it without needing to name names or name clients at all. Although I do have this linking field here if I did. So if you wanted to say, yes, I gave out these supplies to this person, you could link in that client as well. And where that ends up is in a report like this. So I have a supply distribution report showing me, how much food, how much clothing, how many hygiene products that were given out during a certain period, how many, sharps were distributed, inhalation supplies. Also, another one, I kind of folded it all into the same outreach form, although you may have two separate ones. But this was another real life case where a client wanted a way to be able to track, what are all the different talks and presentations and community development work that we've been doing? Who did we talk to? How many people were there? Was there a policy change as a result of the sort of capacity building work that we were doing? All of that can also be tracked in Apricot. So I didn't want to leave you with the impression that that impact management, case management, sort of named work that you're doing with clients is the only thing Apricot can do. It's very flexible, as you can see. You can build forms to capture all kinds of different ways of handling data. You can also do group activities. So in this example here, I have a class called Seeking Safety. It runs every Tuesday and Thursday from 3 to 5 p.m. here's my list of clients that are registered for that course. If I want to, take attendance to say, yeah, they showed up, no, they didn't. There's modules that we have for sort of group work if you're doing those types of, support groups or that kind of long-term group activity as well. So it's also more than just one-on-one case management. Of course, at the heart, impact, as I mentioned at the beginning, is what we're all about. So in conclusion, if you're looking for better tools to track your clients for those long-term case management things, if you're looking to demonstrate your impact with the people that you serve beyond just simple outputs, you've come to the right place. So with that, I will stop talking. Kristen, I'm happy to take any questions.
Yeah, so we got another question in. I also got so excited about launching the last poll first that I'm going to launch the first one now, just if people want to indicate if you want to know more about Bonterra products in general. And then I'll put up the last poll just so then if you want more specific information about Apricot, we can definitely reach out and give that to you as well. So the question that came in is from Christina. So can the data be integrated into different BMI? For example, our data gets integrated with a full department scale BMI. However, it is not communicating all the data to be integrated and telling the narrative accurately.
So as long as that system allows us to communicate with it via something like an API or something like that, we can create those kinds of connections. And as you were kind of alluding to, it doesn't have to be like the whole kitchen sink. You can choose, what's the trigger to allow it to move from one point to another, what specific forms, what specific direction, whether it's Apricot to the system or the system to Apricot. You can do it, that way as well. Great question.
All right. And I'm going to relaunch this last poll here just really quickly. And sorry, that was user error on my end for launching it first. So, and this one will just indicate if you guys want a more personalized demo or if you need to talk to the teams. This kind of will help us guide for the next steps as to where you would fall in the path there with our team. So we'll give people just a few seconds to answer that one. It looks like we haven't received any more questions yet. So I hope everyone found this session informative and hopes that we can definitely help you in the future. Everyone will get the gift of time back. So let me see. We just got one in on the chat there, Colin, if you want to pop it open.
Oh, I see. Thanks, Shirley.
All right. Perfect. So, as I said, we'll reach out with the recording afterwards, and then if you guys have indicated some additional interest, we'll definitely reach out. We appreciate everyone joining today, and I will give you the gift of time of 6 minutes. I know it is not a lot, but hopefully it gives you a chance to get water or take a quick break before your next call as well. So thank you so much, and I hope everyone has a great day.
Thanks, everyone.
Thank you. Bye-bye.
Bye.